Did you know that breast cancer is the most common cancer among women worldwide? Every 2 minutes, a woman is diagnosed with invasive breast cancer, and it's estimated that 1 in 8 women will be diagnosed with breast cancer in their lifetime. But are you experiencing breast pain, lumps, or changes in shape or texture? Don't ignore these potential breast cancer symptoms. What are breast cancer symptoms? Number 1. A lump or thickening in or near the breast or under the upper arm. Number 2. Change in size, shape or feel of your breast. Number 3. Skin changes. Skin changes include puckering, dimpling, a rash, or redness of the skin breast. Number 4. Unusual nipple discharge. It could be clear, bloody, or another color. Number 5. Changes in the nipple such as one becoming inverted. Number 6. New pain in one spot that doesn't go away. Number 7. Growing veins on the breast. What causes breast cancer? Breast cancer develops when abnormal cells in your breast divide and multiply. But experts don't know exactly what causes this process to begin in the first place. However, research indicates that there are several risk factors that may increase your chances of developing breast cancer. These include age. Being 55 or older increases your risk for breast cancer. Sex. Women are much more likely to develop breast cancer than men. Family history and genetics. If you have parents, siblings, children, or other close relatives who've been diagnosed with breast cancer, you're more likely to develop the disease at some point in your life. About 5% to 10% of breast cancers are due to single abnormal genes that are passed down from parents to children, and that can be discovered by genetic testing. Smoking tobacco use has been linked to many different types of cancer, including breast cancer. Alcohol use. Research indicates that drinking alcohol can increase your risk for certain types of breast cancer. Obesity. Having obesity can increase your risk of breast cancer and breast cancer recurrence. Radiation exposure. If you've had prior radiation therapy, especially to your head, neck, or chest, you're more likely to develop breast cancer. Hormone replacement therapy. People who use hormone replacement therapy have a higher risk of being diagnosed with breast cancer. There are many other factors that can increase your chances of developing breast cancer. Talk to your healthcare provider to find out if you're at risk.
How to do a breast self-exam, 5 steps for checking for breast cancer at home. Step 1. Examine your breasts in a mirror with hands on hips. Begin by looking at your breasts in the mirror with your shoulders straight and your arms on your hips. Here's what you should look for: breasts that are their usual size, shape, and color. Breasts that are evenly shaped without visible distortion or swelling. If you see any of the following changes, bring them to your doctor's attention: dimpling, puckering, inverted nipple, redness, swelling. Step 2. Raise arms and examine your breasts now. Raise your arms and look for the same changes. Step 3. Look for signs of breast fluid while you're at the mirror. Look for any signs of fluid coming out of one or both nipples. This could be a watery, milky, or yellow fluid or blood. Step 4. Feel for breast lumps while lying down. Next, check for breast lumps or abnormalities by feeling your breasts while lying down, using your right hand to feel your left breast, and then your left hand to feel your right breast. Step 5. Feel your breasts for lumps while standing or sitting. Finally, feel your breasts while you are standing or sitting. Many women find that the easiest way to feel their breasts is when their skin is wet and slippery, so they like to do this step in the shower. Cover your entire breast, using the same hand movements described in Step 4. Now let's talk about 6 facts of breast cancer. Fact 1. Breast cancer has been called the nun's disease because of the high number of nuns affected. Lifelong nuns, like all women who never have children, are at an increased risk of dying from breast, ovarian, and uterine cancers, compared with mothers. A woman's risk of getting these cancers increases with the number of menstrual cycles she experiences. Fact 2. Breast cancer occurs in both dogs and cats. It tends to be far more aggressive in cats. It is not only humans who suffer from breast cancer, some animals do too. It is more common in dogs than cats, but tends to be more aggressive in cats than dogs. Fact 3. Men get breast cancer too. A man's lifetime risk of breast cancer is about 1 in 1,000. Many people do not realize that men have breast tissue and that they can develop breast cancer. Fact 4. Breast cancer is more common in the left breast than the right. The left breast is 5 to 10% more likely to develop cancer than the right breast. The left side of the body is also roughly 5% more prone to melanoma. Nobody is exactly sure why this is. Fact 5. Most women now survive breast cancer, at least in developed countries. Huge progress has been made in recent years in breast cancer. In fact, breast cancer management across risk, assessment, prevention, surgery, radiation, and other treatment has changed dramatically. Now survival rates are 80% or over in countries like the US, Sweden and Japan. Fact 6. Shift work may increase risk of breast cancer. The International Agency for Research on Cancer recently concluded that women who worked night shifts for 30 years or more were twice as likely to develop breast cancer. However, women who work nights are advised not to panic. It's worth noting that no link was found between higher breast cancer risk and periods of night work which were shorter than 30 years.
Now let's discover 17 foods that prevent breast cancer. Foods to avoid and take. Did you know that the foods you eat can play a huge role in preventing breast cancer? In this video, we'll be discussing 17 foods that have been proven to prevent breast cancer, as well as foods to avoid. So, whether you're looking to prevent breast cancer or simply want to improve your overall health, this video is for you. Allium veggies. Allium is a Greek term for garlic. A high intake of allium vegetables is extensively useful against breast cancer. They contain a protective compound called organosulfur compounds. These compounds possess brilliant anti-cancer properties and are beneficial to breast cancer. Some of the best breast cancer-fighting allium vegetables include onion and chives. Cruciferous vegetables. Cruciferous vegetables like cabbage, broccoli, cauliflower and Brussels sprouts. These vegetables contain glucosinolates which when consumed, get converted into isothiocyanates in the body. These isothiocyanates help to reduce the risk of breast cancer in women. Spinach. Spinach has been found to have anti-cancer properties and may be beneficial in reducing the risk of breast cancer. The high levels of antioxidants, such as beta-carotene, lutein, and zeaxanthin, as well as folate, found in spinach have been shown to have anti-inflammatory effects and may help to prevent the growth of cancer cells. Other leafy green vegetables that prevent breast cancer are fenugreek and radish. Beans, also known as legumes. They are a good source of nutrients and may have potential benefits in reducing the risk of breast cancer. They are high in fiber, protein, and antioxidants, which may help to lower inflammation and support overall health. Additionally, beans contain phytochemicals called lignans, which have been shown to have estrogen-like properties and may help to reduce the risk of breast cancer. Citrus fruits are one of the best fruits for cancer patients. They comprise citrus folium and nobiletin. Apart from that, they also contain carotenoids and beta-carotene. All of them make great anti-cancer agents. Thus, together they inhibit the growth of breast cancer cells. Some of the impactful citrus fruits are lemons, limes, grapefruits, oranges. Pomegranates and pomegranate juice are a very good source of important chemopreventive compounds such as anthocyanin, ursolic acid, ellagic acid, and omega-5 fatty acids. Pomegranate juice has been reported to inhibit metastatic processes in breast cancer cells. Fatty fish and fatty fish oil may help reduce the risk of breast cancer. Omega-3 fatty acids found in fatty fish, such as salmon, mackerel, herring, and sardines, may help reduce inflammation, which has been linked to cancer. They may also help regulate hormone levels, which can help reduce the risk of hormone-related cancers such as breast cancer. Whole grain consumption more than 7 times a week was associated with reduced risk of breast cancer. Higher fiber intakes during adolescence and early adulthood could reduce breast cancer risk. List of whole grains beneficial against breast cancer are as follows: wheat, quinoa, brown rice, barley, oatmeal. Now let's talk about foods to avoid in breast cancer. Did you know that the foods you eat can contribute to the development of breast cancer? Several foods should be avoided to help prevent breast cancer. Continue watching to discover the breast cancer-causing foods to avoid in your diet. Red meat. Women who ate the most red meat compared to participants who ate the least red meat had a modestly increased risk of breast cancer. Alcohol. Alcohol consumption is one of the major modifiable risk factors for the disease, causing 7 of every 100 new breast cancer cases in the region. Refined carbs, such as carbohydrates if consumed in high quantities, lead to weight gain and thus obesity. Therefore, it should be avoided to help prevent breast cancer. Sugar and sugary drinks have no direct contact with breast cancer. However, these drinks may cause obesity, leading to breast cancer. Junk foods. Junk and fried foods may carry carcinogenic elements in them. Not only that, these foods invite obesity too, a close friend of breast cancer. Breast cancer treatment. Surgery is often used to remove tumors or affected lymph nodes. Depending on the type of cancer and its stage of development, different types of surgery may be used. For example, a lumpectomy removes only the tumor while a mastectomy removes the entire breast. Radiation therapy uses high-energy beams to kill cancer cells in the affected area. It's usually done after surgery to reduce the risk of recurrence or spread of the disease. Chemotherapy uses drugs to kill cancer cells throughout the body. It's often used in combination with other treatments such as surgery or radiation therapy. Hormone therapy is used to block hormones that can fuel certain types of breast cancers. This type of treatment is usually used for cancers that are sensitive to hormones such as estrogen or progesterone. These are just some of the treatments available for breast cancer patients today. Your doctor will work with you to determine which treatment plan is best for your individual needs and situation. With proper care and support from your healthcare team, you can fight this disease and live a long and healthy life. Tell us, have you or someone you know been affected by breast cancer? What do you think is the biggest challenge in the fight against breast cancer?